Hello everyone. Today we will discuss about blood coagulation, starting with the basic theory. More than 50 important substances that cause or affect blood coagulation have been found in the blood and in the tissues. Some that promote coagulation are called procoagulants and the others that inhibit coagulation are called anticoagulants. Whether the blood will clot or not depends on the balance between these two groups of substances. In the bloodstream, the anticoagulants normally predominate, so the blood does not coagulate while it is circulating in the blood vessels. However, when a vessel is ruptured, procoagulants from the area of tissue damage become activated and override the anticoagulants, and then a clot does develop. General mechanism of clotting. Clotting takes place in three essential steps. In response to the rupture of the vessel or damage to the blood itself, a complex cascade of chemical reactions occurs in the blood involving more than a dozen blood coagulation factors. The net result is formation of a complex of activated substances collectively called prothrombin activator. The prothrombin activator catalyzes conversion of prothrombin into thrombin. The thrombin acts as an enzyme to convert fibrinogen into fibrin fibers that enmesh platelets, blood cells and plasma to form the clot. We will first discuss the mechanism by which the blood clot is formed, beginning with conversion of prothrombin to thrombin. Let's take a look on this chart. First, prothrombin activator is formed as a result of rupture of a blood vessel or as a result of damage to special substances in the blood. Second, the prothrombin activator in the presence of sufficient amount of ionic calcium causes conversion of prothrombin to thrombin. Third, the thrombin then eventually causes polymerization of fibrinogen molecules into fibrin fibers within another 10 to 15 seconds. Hence, the rate limiting factor in causing blood coagulation is usually the formation of prothrombin activator and not the subsequent reactions beyond that point, because these terminal steps normally occur rapidly to form the clot. Now let's learn about prothrombin and thrombin. Prothrombin is a plasma protein, an alpha-2 globulin having a molecular weight of 68,700. It is present in normal plasma in a concentration of about 15 mg per dl. It is an unstable protein that can split easily into smaller compounds, one of which is thrombin, which has a molecular weight of 33,700, almost exactly one half that of prothrombin. Prothrombin is formed continuously by the liver, and it is continuously being used throughout the body for blood clotting. Vitamin K is required by the liver for normal activation of prothrombin as well as few other clotting factors. Therefore, either lack of vitamin K or the presence of liver diseases that prevent normal prothrombin formation can decrease the prothrombin to such a low level that a bleeding tendency results. Now let's talk about formation of the clot. Fibrinogen formed in the liver is essential for clot formation. Fibrinogen is a high molecular weight protein, about 340,000 molecular weight, that occurs in the plasma in quantities of 100 to 700 mg per dl. Fibrinogen is formed in the liver, and liver diseases can decrease the concentration of circulating fibrinogen. Action of thrombin on fibrinogen to form fibrin. Thrombin is a protein enzyme with weak proteolytic capabilities. It acts on fibrinogen to remove 4 low molecular weight peptides from each molecule of fibrinogen, forming one molecule of fibrin monomer that has the automatic capability to polymerize with other fibrin monomer molecules to form fibrin fibers. Therefore, many fibrin monomer molecules polymerize within seconds into long fibrin fibers that constitute the reticulum of the blood clot. Blood clot. The clot is composed of a meshwork of fibrin fibers running in all directions and entrapping blood vessels, platelets, and plasma. The fibrin fibers also adhere to damaged surfaces of blood vessels. Therefore, the blood clot becomes adherent to any vascular opening and thereby prevents further blood loss. Clot retraction and expression of serum. Within a few minutes after a clot is formed, it begins to contract and usually express most of the fluid from the clot within 20 to 60 minutes. The fluid expressed is called serum because all its fibrinogen and most of the other clotting factors have been removed. In this way, serum differs from plasma. Serum cannot clot because it lacks these factors. Platelets are necessary for clot retraction to occur. Therefore, failure of clot retraction is an indication that the number of platelets in the circulating blood might be low. Platelets entrapped in the clot continue to release procoagulant substances, one of the most important of which is fibrin stabilizing factor, which causes more and more cross-linking bonds between adjacent fibrin fibers. In addition, the platelets contribute directly to clot contraction by activating platelet thrombocysteine, actin and myosin molecules, which are all contractile proteins in the platelets, and cause strong contraction of the platelet spicules attached to the fibrin. This action also helps to compress the fibrin meshwork into a smaller mass. The contraction is activated and accelerated by thrombin, as well as by calcium ions released from calcium stores in the mitochondria, endoplasmic reticulum, and Golgi apparatus of the platelets. As the clot retracts, the edges of the broken blood vessel are pulled together, thus contributing still further to hemostasis. So this was all about blood coagulation, general mechanisms of clotting, blood clot, fibrinogen, fibrin, etc. See you all in the next video. Till then, take care, stay safe.